My name is Kathleen Naylor and I'm a sports medicine physician with Franciscan Physician Network. Even as a kid, I always knew I wanted to be in medicine. I was the kid that wanted to go get the ice pack and the Band-Aid when someone was hurt. I was an athlete growing up my whole life, and so once I found out about sports medicine, it just seemed like a perfect fit. Sports medicine is a specialty that kind of partners with orthopedics to focus on any sort of musculoskeletal complaint. So we see any sort of muscle, bone, joint issue or injury, whether it's an acute injury or overuse. When I care for patients, I like to spend my time with them. I think it's really important to get to know my patients. I think it helps build a sense of respect and open communication. I think when I have a patient in my office, if I really take the time to listen to them, they usually do a pretty good job of giving me an idea of what's going on right away, even before I do an exam. And I think it's a privilege to be able to help people get back to their normal quality of life. My passion is patient education. I think that it's important for a patient to really have an understanding of what's going on with them. So I take my time to go through a little bit of basic anatomy with the patient, let them know about structure and function and how they're related and how they can kind of come into play with what might be going on with them at the time. I think it helps a patient get a better understanding of the treatment plan and also makes them a little bit more motivated to help with their rehab and recovery. Here at Franciscan, the piece of technology that's been most helpful for me in my clinic is the utilization of AI. They have software now that's able to help me with my documentation, which allows me to be more present during my exam and not spend so much time on the computer, which just gives me more time to focus on the patient. I think one of the big misconceptions about sports medicine is that we only treat athletes, but really we see people of all ages, anybody that's physically active. So if it's an athletic injury or just an overuse or just any sort of chronic muscle or joint pain, we're happy to see in the office and do a good thorough evaluation. Outside of work, my husband and I are very busy with our 3 kids. They are very active in sports. So usually outside of work, you can find me on the sidelines, either working an event or as a proud parent. But I also enjoy sports of all kinds. So we also enjoy going to a lot of football games, soccer games, baseball, just usually as a spectator. One piece of advice that I would give my patients would be just to stay active. There is something to be said for that old saying of if you don't use it, you lose it. And I think staying active and keeping the body moving is the best thing that you can do for your overall health.